You said it was going to.
Todd, what I am. I lived in Alabama, North Carolina. I went to high school in Virginia. Yeah, or Navy base. No, Alabama was Air Force.
Susan from Wisconsin.
Okay, gentlemen, y'all ready? Are you guys ready? Okay. Morning, I'd like to open the Board of Supervisors meeting. We are going to be going into closed session. Madam Clerk, could you please read the items?
Item number 1 is conference with legal counsel regarding existing litigation pursuant to Government Code Section 54956.9D1, Calaveras residents against commercial marijuana versus County of Calaveras, Board of Supervisors of Calaveras County et al. Calaveras County Superior Case number 19CV 44446. Item number 2, conference with legal counsel regarding litigation, significant exposure to litigation, one case pursuant to Government Code 54956.9D2. Item number 3, conference with legal counsel regarding anticipated litigation, significant exposure to litigation, one case pursuant to Government Code Section 54956.9D2. Item number 4, conference with legal counsel regarding anticipated litigation, significant to exposure to litigation, one case pursuant to Government Code Section 54956.9.
I'd like the public to know if you go to the board's agenda, you can click on the Zoom connection and you will be connected to the boardroom. You will be muted. And when it's time, if there's any comment, please raise your hand. When we go into closed session, everyone will be disconnected, and then we'll reconnect you when we come out of closed session. Are there any comments on any of the closed sessions? Okay. We will adjourn into closed session. Thank you. Okay. Good morning. I'd like to reconvene the Board of Supervisors meeting. We were in closed session, and we will be going back into closed session at the end of the board meeting. If you can, everyone, please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Ms. Glanville, could you please report out in the closed session of September 22?
Closed session report out for September 22nd. Pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiator Judy Hawkins regarding employee organizations, SEIU, and Sheriff's Management Unit. There was no reportable action taken by the board.
Okay, thank you. I'd like the public to know if you go to the board's agenda, you will find the information to Zoom into the meetings. You will be automatically, what's the proper term, muted. And if you have a comment to make when we ask for public comments, please raise your green hand. If that doesn't work, maybe you can wave and Ms. Glanville will find you. I'd like to move to staff announcements. Are there any staff announcements this morning?
Yes, good morning, Madam Chair. Lisa Medina and respective board members. Lisa Medina, Environmental Management Agency Administrator. I wanted to announce our animal service team is holding an event from Tuesday, October 20th through Saturday, October 31st for our shelter animals. We are looking for Halloween treats, dog food, cat food, some toys, anything that our community feels that our shelter animals might be in of need. It's going to be an exciting event. We're looking forward to seeing our community. We will have several drop-off bins and or receptacles in the Animal Services parking lot located at 901 Jeff Tuttle Drive. Phone number for Animal Services, should you have any additional questions, is 754-6509. We're also thanking our focus group, our friends of Calaveras Animal Services, for their continued support in providing spay, neuter, medical adoption, and shelter enhancement support for our pets and for our ones that we are caring for in our shelter. So we really wanted to give a shout out and thanks to them. And that is all I have. Thank you.
Okay, thank you. Are there any other staff comments?
Yes. Board Chair Judy Hawkins, Human Resources and Risk Director. I would like to remind the board that we are currently in the middle of open enrollment. And so I would like to remind you that if you have not turned in your paperwork, you have until the end of this week at 5 p.m. to get your forms in.
Thank you.
That's it.
Ms. Lamb, any other staff comments?
Not that we were notified of.
Okay. All right, thank you. I'd like to move to the regular agenda. We'll have a report out from Public Health on COVID-19, and the City of Angels will be joining us.
Good morning, Madam Chair, Board of Supervisors, Angels Camp City Council members. This is Dr. Kaleda. I'm the local health officer for Calaveras County. We've gotten to know each other well since this pandemic started, and I'd like to give an update to the community regarding COVID-19 and where things stand right now in our community. Statewide, California has reported 850,000 confirmed COVID-19 cases with 16,572 fatalities. Calaveras County confirms 330 coronavirus cases with 16 deaths. Our county is currently averaging a rate of 1.61 new COVID-19 cases per 100,000 population compared to the overall state rate of 7.1 new cases per 100,000. So we're doing much better than the state average. We're performing 190 tests per 100,000 residents every day with a positivity rate that's now less than 1%, which is a significant reduction indicating decreased community transmission taking place. The overall state rate for positivity of tests is 3.2%. Calaveras County's seen a steady reduction in the rate of new cases and testing positivity rate over the past 5 weeks. Because of this decrease in community transmission occurring, Calaveras County is currently in the moderate or orange tier, the third tier of the state's blueprint for safer economy. This is the 4-tier system that rates states based on each county's disease activity in order to determine what types of social and economic activities are allowed to be engaged in each community. So if you remember, the tiers are purple, that's the highest, widespread, then substantial, which we were originally red, and then orange, moderate, and then down to yellow, minimal. We're hoping to get down to the minimal stage in the next several weeks. Now that Calaveras County's been advanced to this moderate orange tier, that means that certain business activities may resume and even expand with modifications. I've given examples in the past of some of the most common things. In-restaurant dining services can be at 50%. Movie theaters can be at 50% capacity. Hair salons, barbershops, personal services can resume with certain modifications. Gyms and fitness centers can resume indoor operations and even at 25% and even operate indoor pools if they have them. Schools are eligible to resume in-person classroom instruction for children at the discretion of each school district. Visit COVID-19california.gov and click on what's open in my county for more specific business information on over 290 different business activities that are listed in more detail. And that's good for the businesses too, because they can look and see what their modifications are that they need to put in place to operate. The outbreak of COVID-19 infections at Avalon, San Andreas Convalescent Home, has slowed down and is abating. To date, infections in 60 residents and 28 staff members have been confirmed through enhanced testing of all residents and care staff. The facility continues to undergo close surveillance for the prompt identification of any new cases, and infection prevention activities will continue. Avalon has the ability to perform rapid point-of-care COVID-19 testing for their residents and staff members, and this helps reduce the turnaround time for test results and improves the efficiency of the disease control response. The facility, public health, and Mark Twain Medical Center are in regular communication regarding the situation for the potential need of increased hospital capacity in the event that more sick residents come from the nursing home. There's currently no Calaveras County residents hospitalized with COVID-19. Local hospital capacity remains adequate. Ventilator availability is at 100%. Mark Twain Medical Center has regular patient care beds, ICU space, and a pretty robust supply of personal protective equipment, PPE, the masks and gowns and gloves and all of the things that help protect the healthcare workers and reduce the risk of transmission in the hospital setting. They got a lot of that. So in both their hospital and outpatient clinics. The Optum Serve test site, which is shared between Calaveras and Tuolumne counties, will move to the Tuolumne County Fairgrounds in Sonora starting November 1st. No-cost testing for COVID-19 remains available now for anyone who'd like to get tested. The Optum Serve test site is located at the Calaveras County Fairgrounds, and it's open Tuesday through Saturday from 7 a.m. to 7 p.m. It's available for those age 3 and older to go in there and get tested. So people are encouraged to register online. Walk-ins will be accommodated, and people can call a toll-free 888 number to make it time to get tested as well, and that number is referenced on our website. I'll just say it, it's 888-634-1123. Pertaining to gatherings in relation to Halloween, Thanksgiving, or winter holiday events coming up. As of October 9th, 2020, there's an amendment to the current governor's stay-at-home order, providing for outdoor private gatherings being allowed only under the following conditions. Attendees must be from no more than 3 separate households, and duration should be less than 2 hours. So that's a pretty simplified way of knowing what gatherings are appropriate. So less than 3 households for less than 2 hours. Any gatherings observe these safety protocols: wearing a mask, practicing physical distancing, hand washing. Don't attend if you have COVID-19 symptoms, and don't attend if you're at high risk for serious illness from COVID-19 infection were you to get it. Health officials such as myself are concerned about the potential for concurrent presence of COVID-19 and influenza viruses to be circulating together this fall and winter. Simultaneous outbreaks of flu and COVID-19 could drain the county's healthcare resources. Getting a flu shot protects you and your family has never been more important. Calaveras County Public Health will offer a drive-through flu clinic on Thursday, October 15th, this coming Thursday, from 9 a.m. to 4 p.m. at Calaveras High School in San Andreas. Preliminary planning activities are underway by Public Health in preparation for distribution of the COVID-19 vaccine when it becomes available. And this is going to be in our community through mass vaccination clinics. We don't know the time frame. I don't predict it's going to be until early 2021. But we're already in preliminary planning stages about how to distribute the vaccine effectively in our community when it becomes available. We continue to learn more about this coronavirus every day. This information helps guide our public health response. To protect all Calaveras County residents from this virus, it remains important to stay home if you're sick, stay at least 6 feet away from people outside your household, wash hands with soap and water, avoid touching your eyes, nose, and mouth with unwashed hands, and to wear a face covering when around others. You've heard this, my baseball analogy. If the coronavirus pandemic were a baseball game, we'd now be in the 6th inning. This is why we've chosen a low and slow approach to determining when activities and businesses should open further. We're continuing to monitor disease activity weekly for signs of resurgence, especially looking toward the fall and winter for a potential second wave. So to continue to move in a positive direction, the public is urged to continue to wear a mask, which I've seen improvements of over the last several weeks. Keep your distance, get tested, wash your hands, stay home if you're sick. These are the tried and true messages that can be effective if people adhere to them at very high rates. I'd like to conclude by announcing that after 20 years of serving as health officer for Calaveras County, it's time for me to step down. I've provided health officer duties to our community 24 hours a day, 7 days a week for this entire 20-year span. To be effective as health officer, I've always done my best to assist leaders, decision makers by providing accurate medical and scientific information, as well as technical expertise unbiased by subjectivity or partisan influence. These positions are hard on those who serve in them, and it's time for me to refocus on my private practice of medical practice and on my relationships with others, with friends and family. So due to these considerations, I'll be resigning as health officer. My last day of service to the county will be Friday, October 16th at 5 p.m. I'm confident that under the competent leadership of Kristen Stranger, HSA Administrator, and the excellent Public Health Department professional staff, the community will continue to be steered through this COVID-19 pandemic, and the health of our residents will continue to be protected until such time that a new officer can be recruited. So now Kristen Stranger can provide you any additional information regarding some of the other social service impacts of the COVID-19 pandemic.
Thank you, Dr. Kaleda. Good morning, Madam Chair, members of the board, Kristen Stranger, Health and Human Services Agency. So building off of Dr. Kaleda's communication about the gatherings guidance being revised and distributed this past Friday, we've also learned actually during the course of this meeting that today at noon, we will be receiving specific Halloween guidance and Dia de los Muertos guidance. So that will be available on our website once it is released to the public. It will focus on safer alternatives to traditional holiday celebrations and will provide additional recommendations for how to maintain safety during the Halloween and Dia de los Muertos celebrations. Also, another change that has happened over the past week is that under the Blueprint for a Safer Economy, small counties are continuing and will be continuing to be subject to the existing Blueprint for Safer Economy rules. Those are things such as testing positivity thresholds, minimum durations of being in the 3 weeks of tiers, the inability to skip a tier while moving to a less restrictive or more restrictive tier. These are things that Dr. Kaleda has covered regularly since we have moved from the county monitoring system to the Blueprint for a Safer Economy. However, small counties did raise the concern and issue that daily case rates have the ability to create dramatic swings on a weekly basis when you have even just a small number of cases. So because of that, with input, the state has recognized that this has the ability to negatively impact counties for isolated incidents, even when the counties have the ability to conduct proper test follow-up, investigate cases properly, as well as conduct or provide support to those infected individuals and those that were in close contact. So because of that, the state has released an alternative for smaller counties that are under 106,000 people as part of their population, which would be an absolute weekly case number. The whole point of this, again, is to try to prevent large swings and impacts to the local economy and business sectors and sector guidances, and the various sectors who could be impacted by movement to a more restrictive tier. So basically what it's done is it's create, again, the absolute weekly case numbers that small counties will be subject to in order to move to a more restrictive tier. Those numbers are for our county, which is between the 35 to 70,000 population. It would be from yellow tier, it would be 14 cases. For orange tier, it would be 21 cases, and for red tier, it would be 42 cases. Again, we are grateful to our advocacy organizations for working collaboratively with the state to make this an option for counties, particularly smaller counties who have the ability to be impacted greatly as it pertains to the reopening process due to isolated incidents that could have numbers that are, for a weekly basis, higher than the pre-existing state thresholds. Also, recognizing that certain racial and ethnic groups have been disproportionately affected by the COVID-19 pandemic, the state has put forward a new health equity metric that counties will now be required to respond to, and it will be part of the evaluation process as a county moves to a less restrictive tier. That being said, this metric does apply only to larger counties. It does not apply to the smaller counties such as Calaveras. However, counties such as ours are all in the process of creating a targeted investment plan that is a requirement of all counties. The purpose of that is to support local communities in achieving health equity achieving the health equity measure and looking at the recovery process with the health equity lens. This is not new to Calaveras Public Health. This is something, the concept of looking at the response effort through a health equity lens has been something we've been doing since the onset. However, we are going to go ahead and continue to prepare our information and respond to the state, which is again a requirement as part of this effort. The last thing I wanted to touch upon today is just an update to the board and the community on where we are in terms of securing interim health officer coverage. We are diligently working on this. We expect to have a finalization of this by midweek, and I intend to bring to the board an agreement for next week to be able to solidify this some interim health officer coverage. We have a number of options kind of shoring up at the very last minute. I would like to recognize Dr. Kaleda for his leadership, expertise, and commitment to the health and safety of our community. I'm grateful for the opportunity to have worked with you, and I wish you all the best in your future endeavors. With that, Dr. Kaleda or myself can take any questions.
Thank you. Does the City of Angels have any questions or comments they would like to make?
I think we need to make our presence on the call.
Oh, I'm sorry, Major Joe. Go ahead.
So we'll go ahead and do that. Susan, you do a roll call so we know we're all here.
Mayor Oliveira,
Present.
Vice Mayor Berlio, Councilmember Herman,
Present.
Councilmember Follendorf, Councilmember Matilde. Thank you, Joe.
And this is Alvin. I just dropped right, I think, when you said my name, Susan.
Okay, and I've seen you on there earlier. Great. Thank you.
So we have a quorum, and I think we need to read a public comment statement. Susan, correct?
The county will open public comment.
Good for that. So I think before I turn it over to council, I'd just like to add on behalf of the people of Angels and the City of Angels, Dr. Kaleda, thank you for your many years of service, and we wish you well in your private practice and more personal time for yourself. Thank you.
Thank you,
Okay,
Mayor.
council, any comments for the doctor or Kristen?
This is Linda. I just had a question. I didn't, excuse me, I didn't quite understand the case number, small counties, the 35,000, 70,000, yellow and orange and red, with the numbers. I wasn't quite understanding if Kristen Strange could explain that again. I'm not quite getting it.
Sure. So one of the metrics that we're evaluated on has been a daily case rate, right? And that's a percentage that is taken into account based off of our population and such. That has the ability to negatively impact counties by, if you have, let's just say even as small as 2 cases per week for 2 consecutive weeks in particularly small counties, it has the ability to drive up that case rate, where those small numbers of positive cases, the health department might have the capacity to actually properly investigate those in a timely fashion and provide the contact tracing, basically the spirit of what contact tracing and disease mitigation is about. So what they've done is basically, instead of moving from that percentage-based daily case rate percentage that we've been evaluated on, we've moved to absolute weekly case numbers. And so that would be required to move to a more restrictive tier. So basically, if you have more than 14 cases, more than 21 actual cases, more than 42, depending on where you are in the tier, right, higher being moving back down, it's put into place to kind of take into consideration those times where you'll have maybe a large number, but it's maybe a single incident as opposed to larger scale disease prevalence. Does that make sense?
Yes, okay, good, thank you.
Are there any other questions or comments from the city? Are there any questions or comments from my colleagues from the board? Mr. Stopper?
I just want to say to Dr. Kaleda, 20 years of service is quite some time. You've invested a lot of energy and time into this county. I think I worked on your house in 2004. So, I've known you for quite some time, and we both have children of our families that have gone to school here. You've thoroughly invested in it, and I can't say I'm not a little bit envious of you getting back to spending more time with your family. It's a good positive thing. On one hand, I haven't always seen eye to eye with you, but at the same time, I know your heart and your soul's in the right place on how you proceed, and you will be sorely missed. Thank you for your time, Dr. Kaleda.
Supervisor Garamendi.
Thank you, Madam Chair. I'll add my gratitude along with Supervisor Stopper to Dr. Kaleda for his many years of service. We're happy to have him be able to spend more time in the community and Mokel and hope, and I want to really thank him. 20 years is a long haul, and this has been maybe in this last 6 months should qualify as another 5 years, just in stress and work that's gone. So thank you very much, team. Look forward to next phase.
Supervisor Mills.
Yes, Dr. Kaleda, I know that in our case, I haven't always seen eye to eye with you either, but 20 years, you've seen a lot of supervisors come and go. You've seen a lot of different issues arise in this county. The last 6 months has been a very trying time, I think, for everyone, but at the same time, you've handled it professionally, and I appreciate your clear and concise data that you've been bringing to us so that we can make sound decisions. But I also appreciate the 20 years of service. That is a long time to be engaged as much as you have, and then still maintain your practice and everything else that you do, and a quality of family life. So it's with appreciation that you've served your time, and we hope for the best for your future.
Where is he? Supervisor Tuffanelli.
Yes, Dr. Kaleda, thank you very much for your 20 years, and I ditto everything that's been said by the other supervisors here. I wish you well in the future, and spend some quality time with your family. That's very well needed. Thank you very much.
Ms. Glanville, are there any public comments?
Do you want to read this?
Yeah, please.
We did receive one written public comment.
Dr. Kaleda, could you put your face up on the screen?
Yeah, I
Thank
think
you.
that my camera's on. Madam
Got
Chair.
it. I think you're going to want to hear this. Ms. Glanville.
Members of the Calaveras County Board of Supervisors, we, the undersigned, former Calaveras County Public Health staff, wish to acknowledge, recognize, and thank Dr. Dean Kaleda for his commitment, expertise, and professionalism as the county's health officer for the past 20 years. A health officer's job is most often performed without fanfare, yet the responsibility is tremendous. It is extremely disheartening that during the COVID-19 pandemic, the county's political climate has made this talented local physician's community work intolerable to the point of resignation. As colleagues, we worked with Dr. Kaleda through countless flu seasons, chickenpox, norovirus outbreaks in local schools, wildfire disasters, the aftermath of 9/11, H1N1, and pandemic planning efforts. His commitment to provide quality medical care and direction was and continues to be based upon universally adopted medical standards, best practices, and science, not politics. We witnessed Dr. Kaleda's tireless efforts to keep Calaveras residents and families from serious illness, infectious disease, and premature death. Because of Dr. Kaleda, lives have been saved, and Calaveras families and communities have been healthier and safer. We wish to tell Dr. Kaleda his dedication to public service has not gone unnoticed. We appreciate and thank you, Dr. Kaleda. Respectfully, Jeannie Boyce, M.A., Colleen Tracy, M.Ph., Kim Thank you very much. Suzanne Whiteley, Jane LaFleur, Debbie Brooks, and Jill Sullivan.
Could you please get a copy of that to Dr. Kay? Are there any other public comments? Well, I'm the chair, so I get to go last, Dr. Kaleda. So, on behalf of the Board of Supervisors, here's a coffee mug where you will remember us, and your mantra is on the other side. Wear your mask, wash your hands, and since I'm giving this to you from a distance, I've got that covered. And truly, on behalf of the board, we thank you for keeping us focused, keeping the mantra going for the last 6 months. And maybe we'll even see a letter to the editor from you telling us all the same thing. But from the bottom of our hearts, thank you for what you've given to us. And I don't know, maybe I'll drop this off at your medical office one day with coffee in it. Thank you, Dr. Kaleda, very much. This one? Can you see that? Do you see the other side? Got it. Thank you. I know you don't like being front and center on things like this. But is there anything else you'd like to say? Otherwise, I'll have Ms. Glanville mute you.
No, I appreciate the kind words. Again, I think several supervisors have put it, I think, very well. We haven't seen eye to eye on some of these issues, but I appreciate the board's listening, and I appreciate the board's engagement in this pandemic, and everybody trying to do what they think is best to protect the health of this community. And I think my biggest acknowledgement is to the public and to the community and to the residents of Calaveras County. There have been people that have, directed, negativity towards me over the events of the last 6 months since this pandemic started. But I've always been able to know that, that's a minority of this community. And wherever I go and patients that I see, people that I live with, people that I work with, people that I see around the community, I'm always very surprised and I take it to heart that this community is very much supportive of science. This community is supportive of reasoned thinking and activities. And the vast majority of this community is looking towards us in the science and medical community and looking to you as the Board of Supervisors and the decision makers to protect the health and safety of this community going forward. So I encourage you to continue to do that and to listen to those voices and not the ones that make the most noise or the lunatic fringe. Listen to the voices of your constituents, and that's going to help guide us going forward. Thank you.
Thank you, Dr. Kaleda. If there's nothing else, we'll move to the next item. Pardon? We did. You read the letter?
Okay. I don't know if you had anything. The
Pardon?
city council needs to adjourn.
Oh, yes. Thank you, Susan.
Certainly.
Please, go
Great.
ahead.
Susan, why don't you take a motion for adjournment and then a roll call vote, and then we'll adjourn.
Sounds good.
This is Alvin. I'll move to adjourn.
I'll second it. No, Amanda second.
Okay, Mayor Oliveira,
Aye.
Vice Mayor Brolio,
Aye.
Councilmember Herman,
Aye.
Councilmember Follendorf.
Aye.
Passes, and you are adjourned.
Okay, thank you, Madam Chair.
Thank you.
Thank you, Mayor. Thank you, City Council. I'd like to move to item number 6. This is from Health and Human Services, proclaiming October as National Breast Cancer Awareness Month. Ms. Stranger, did you have anything you wanted to say on this?
Apologies, Madam Chair. Working through turning my computer back on. No, I do not have additional comments beyond what we put forward in the staff report and the proclamation.
Okay. Are there any board comments on this item before I read the proclamation? Are there any public comments on this item? Okay, I'll read the proclamation declaring October 2020 as National Breast Cancer Awareness Month in Calaveras. Whereas breast cancer is the second most common cancer in women, and whereas about 1 in 8 women born today in the United States will develop breast cancer at some point in their lifetime. Whereas early detection and treatment of breast cancer allows most women to live long and healthy lives. And I do have to say this also impacts men. Whereas mammograph is the best way to find breast cancer, and I do encourage women to also do self-exams. It's not part of this, it's my editorial comment. And whereas public awareness and early detection can increase the number of women who survive breast cancer. Therefore, be it resolved that the Calaveras Board of Supervisors proclaims October as National Breast Cancer Awareness Month in Calaveras. May I have a motion on the proclamation, please?
So moved, Madam Chair.
Motion by Supervisor Mills. Is there a second?
Second.
Second by Supervisor Garamendi. All in favor?
Aye.
Aye. Opposed? Passes on a 5-0. It was passed and adopted by the Board of Supervisors, the County of Calaveras, on the 13th day of October 2020. Ms. Stranger, thank you very much for bringing this forward. Oh, I did do public comments before I asked for the vote. Okay, thank you. All right, I'd like to move to public comments. Again, I want to remind people, if you go to the agenda, you will find where you can zoom in on the meeting, and you will be muted, and raise your hand if you would like to say something, and Ms. Glanville will recognize you when the time comes. Are there any public comments? Ms. McBride.
Good morning, Terry McBride, New California State Calaveras County Committee Chair and Senator. On September 30th, I had delivered to each of you, via Robin here, a presentation and recognition of New California State. Calaveras County will be a part of it. And what I want to put out, I'm not going to worry about reading the grievance today, because what I want to say is I'm happy to meet with any one of you, one or all, so that you understand the benefits that this is going to bring our county and our citizens. And won't it be nice, instead of worrying about what the state of California is telling you to do, you get to listen to the citizens of your county, because that's what it's about. It's bringing back the sovereignty of the counties. We haven't had that in a long time. It's bringing back common sense. And we have been missing that for quite a while. I'm sure you've heard the latest dictates from our governor in regards to family gatherings. Who in the hell does he think he is? We are Americans. And Thanksgiving is coming, and Halloween is coming, and Christmas is coming, but you're limited to your family gatherings. That's called dictatorship. It's called communism. It's called Marxism. And we are standing up against it, and proud to be doing so. So I gave you folks this because it's a formal that we have to do. We are going through the full process this weekend. Thursday, Friday, Saturday is our 7th Constitutional Convention. And it's happening. It's just a matter of time, and it's not going to be very long. So anyway, basically, I wanted to reach out to you. Most of you know how to get a hold of me. God knows I'm around. Get a hold of me. I will come and talk to you. If you have really deep questions, we could even get Paul Preston in. If I don't know the answer, I'll find it out for you and make sure it's correct. It's going to be a time of integrity within our state government, and we are in need of that. And it's going to be a whole new concept. We'll get businesses going again, less regulations, less taxes. It's a wonderful thing. So I hope that you will engage with me. I'm here for you if you have any questions whatsoever. And I welcome you to check out our websites. I welcome you to call into our public meetings Sunday and Wednesday evenings at 7 o'clock. You can ask questions. You can just call in and say, Gary Calaveras. And we have a lot of people call in and never even introduce themselves because they're just kind of shy. We hear that a lot. I'll hear lots of people say, well, Terry, I don't want to introduce myself. I'm kind of shy. And that's just fine. But you'll hear directly why California is failing. It's a failed state. It's $120 billion in the red. And you guys aren't being told that. And that's a fact. And so New California is happening. I'm here. Reach out to me. I'm happy to meet with you, whether I've seen eye to eye with you guys or not. This I think we will, because you're going to like what it's going to do. I also have a request. Please put that timer up. Makes it hard. I can't judge 3 minutes. When I see the timer, I can judge, and then I can hurry up. Thank you.
Thank you. Ms. Glanville?
I don't have anybody on the computer.
Okay. All right, I'd like to move to the consent agenda. These items are normally routine, non-controversial. They will be acted on at one motion unless a member of the board, staff, or public would like to pull an item. Is there any member of the board who would like to pull a consent agenda item?
Item number 15.
Okay. Any other board members? Okay. Any staff member wish to pull a consent agenda item? Any member of the public like to pull a consent agenda item? All right. May I have a motion on the balance minus item 15?
So moved, Madam Chair.
Motion by Supervisor Stopper, second by Supervisor Mills. All in favor?
Aye.
Opposed? Passes on a 5-0 vote. Item 15. Supervisor.
Yes, Madam Chair. I pulled this item because we're asking to adopt a resolution changing the position control list for Health and Human Services by adding a mental health division, in the mental health division by adding a supervising clinician, and it's grant funded. So if we're adding this to our list, what happens when the grant goes away? It seems these things keep getting added, and then when the grants, we don't contract back. How are we going to fund this when the grant is no longer? That's my question.
Ms. Stranger, did you hear Supervisor Tuffanelli's question?
Yes, I did, Madam Chair. Good morning. Madam Chair, members of the board, Kristen Stranger, Health and Human Services Agency. So this position itself is funded by a very large grant that we received, $2.5 million, I believe, over the course of 4 or 5 years. And it is, the purpose of it is, again, is to create the wellness centers. It was a joint collaborative that we developed with the Office of Education. Yes, it is grant funded. It is a lengthier grant. We do not have a position that can provide oversight to this very large scale grant that does have a number of requirements. We have, the intention is to recruit somebody who's qualified and somebody who is has the ability to provide this oversight. That is very difficult to do with a limited term position, particularly at this level, since this is a management level position. As we do with every natural attrition that we have in our organization, we always look to provide, to make sure that before we recruit, we've made sure that we've evaluated if we have the capacity to provide the service before moving forward the position. We don't at this current time. In order to oversee this position is necessary. We do have sufficient funding in the worst case scenario. We do have sufficient funding to be able to continue to this position. But again, the real purpose is for the concept of being able to provide and receive the type of candidate that will need to provide the oversight. So your question is one that we very much considered and understand, and that is the rationale for why we're intending to make it a permanent position. Judy?
Yes, and as Supervisor Tofinelli, Human Resources did discuss the scenario with HHSA over the fact that this was a grant-funded position. Limited term positions, typically we only keep somebody limited term for a couple of years. Typically we don't want it to go past 2 to 3 years. This grant is longer than that. And then also through attrition, if something was to happen to lose the grant, we most likely could put this position, this person in a position that opened up.
Yeah, we're funding a position with one-time money, and then we're looking to keep it going by your statements afterwards with funding. That's what I'm afraid of. Okay, thank you for your explanation.
Okay, are there any Supervisor Mills?
Yes, I was going to pull this item as well. Kristen, when we look at the financing on the agenda packet of a fully loaded increase of nearly $60,000, and yet to my question that you did respond to, the annual increase is approximately $11,699 for this fiscal year and $16,810 for next fiscal year. But if you look at next fiscal year on the fully loaded, the increase is if fully loaded would be $105,763. I'm having trouble matching up those numbers to ensure that there is a wash between the increase and the actual grants for the 0.4 FTE that's being requested here.
Good morning, Supervisor Mills. So the question you asked me about was actually related to agenda item 14 over the weekend, and that's for the community services liaison increase to the FTEs. Yes, so the one that we're discussing is actually the supervising clinician, and the numbers for increase for the current year is approximately $59,000, and the numbers for ongoing would be approximately $105,000. So did you want to apply that same question to this item, or yes, does that all kind of?
No, yes, I think it needs to be applied here.
Okay.
I just want to be sure that the grant is going to fully fund the increase, the 4.4 FTE that is being requested?
Yes, that is the purpose, and that is what is going to happen.
And should the grant go away, or for some reason we can't sustain that amount, that we're going to then reduce the FTE on this position?
Yes, if in the event that the grant does not continue, we will work to either reduce the service, modify the service, or identify an alternative solution of which we'd be very transparent with the board on. As with other grants that we've received like this, we have another large-scale triage grant that is we've been successful in obtaining multiple years, right? And so this is something that we probably intend to continue to pursue even beyond the grant term. But the way that the funding works, it is only for this 4 to 5 year time period. And so we are in the predicament of which Judy and I explained earlier. For the current time, though, the funding that is part of this grant does provide the funding necessary for the fully funding of this position. And we'd have to evaluate in the future if we were not successful in reobtaining the grant, we'd have to identify an alternative solution.
Well, and that's what I was trying to get to is that when you have the funding in the grant and the grant's no longer there, that there should be, I just want it on tape that there needs to be some way to be sure that we're not building a position and then the position stays even after the grant goes.
Understood, but we do have natural attrition, and these are difficult to recruit positions. So in the event our intention as the administrators here would be to make sure that we can evaluate, perhaps we have an additional need in another program, or we have somebody who's potentially retiring. We can move bodies around to be able to perform these functions. But again, this is a difficult to recruit position. It is for a longer term period, as Judy had explained earlier, and we do have the need, as I explained. But your comments and the questions from both you and Supervisor Tofinelli are not lost on me. But this is a need that we do have currently.
Okay, thank you.
Mr. Stopper?
Understand this is a long-term grant, and with it being a position that's harder to recruit on, I understand you doing it in this fashion to be a little bit more competitive and appealing to people that may put in an application. But in the future, could we consider putting some type of sunset clause where not necessarily that it says it goes away when the grant money comes, but or when the grant money is ended or the program's, done, could you put something in there that at that time you would bring it back to the Board of Supervisors so that we could reconsider if we would like to continue it at that point and so on, that way it still looks appealing, but at the same time we can, as things are fluid, we can make decisions that reflect the time that we're in.
Actually, if they're not going to be pursuing it after the grant fund has been expended, then it would have to come back to us to eliminate this position. But that doesn't seem to always happen when we create these positions, was my point, and then it doesn't come back to us to eliminate these positions. So we always have these unfunded positions hanging out there in what you call parking lots. And then they sit there for years, and finally we come and bring it to us, and we eliminate them. The point being is this is a grant-funded position, and we're now creating it, and it's going to be there, created, even when the money goes away. It will still be there until it comes back to the board, and we eliminate it.
Right.
So it's going to be hanging out there, and that's part of the point that I was trying to make. And then how are we going to fund it afterwards? Sure, we can move bodies around, but it's going to be there, and it's going to show there in a position control list, and it's going to be $105,000 sitting there, and it's going to be funded and non-funded, or we won't fund it. However, it comes back to us at budget time, but the position will be there until it comes back to us to readjust the position control list, and it just keeps happening.
I understand that, Tofinelli, and it's a very good point. That's why I was talking about a sunset clause in here, saying that at that point it's considered closed and to be brought back to the board at the end of this grant or the end of the program as such. So that way it's not one of those empty parking lot or empty positions in the parking lot, sorry, because the parking lot's full with empty positions.
Supervisor Stopper, yes, we have no issue with bringing back a status report and then receiving additional direction from the board at the conclusion of the grant, or even notifying the board that the grant's been extended or is going to take a slightly different turn. To address Supervisor Tofinelli's point, HHSA does not do what you said. We are very diligent on eliminating and adding positions as the business need is identified and is addressed. We do that through the budgeting process very regularly, and we do have a history of making sure that we're paying close attention to the positions we have, and when those are not needed anymore, we do eliminate those. Judy?
Yes, and I do want to also, we can't, if we put a sunset date on a position, then it's a limited term position. Permanent positions, we can't put a sunset date on the position, just bringing, we can bring back the grant. Also, we got rid of all of the parking lot position several years ago, and right now the only position that is technically going into the parking lot is the deputy position that we just recently discussed in the budget hearings.
Mr. Mills?
Yes, I concur with Supervisor Stopper and Supervisor Tofinelli on this issue that there needs to be some way of confirming that when the grant is ending, that the board has an opportunity to take another look and review and possibly adjust, that it just doesn't automatically revert to finding funding from another source. I think the board needs to be involved in it. So I'm kind of hearing a policy direction from at least the three of us that that's what we're looking for with this particular agenda item. So take it for what it is. I just think it's important that the board be engaged in where these positions are being utilized and the funding for them.
Any other comments?
Well, I apologize. You're right. We did eliminate the parking lot, but it's, as you stated, there is a position going back in there. So it's starting again. And I recall it's been a few years ago that we did do that. But there are other areas that we have created positions that have to come back to us if they're no longer because of grants or whatever. And we continue to carry them, was my point. So I'm in agreement with Supervisor Stopper and Supervisor Mills that this one, that we need to do something. I understand what you're saying, Judy, about we can't put a sunset date on it because then it doesn't become a permanent position. But at least we can put something in there that says when the grant fundings are expended, that it can come back to the board for our decision. That's not actually putting a sunset on it. It's just bringing it back to the board. Do you agree with that?
Yes, we can definitely, because that is the funding for the position. Yes, we would bring back to the board.
Okay, thank you.
I guess I don't agree with that. We have other departments that have grant-funded positions.
Yeah.
We haven't made that. The question comes up every time we get a grant. I don't deny that. But we have the opportunity at budget time when we review the position control list, and it discusses how we fund positions. And if we make this requirement for this position, then we better be making it a requirement for every other grant position. And that, to me, is redundant to what our job is at the budget hearings when we do the position control list. So it was we made a very cognizant decision on the deputy position because of the deputy that was going on military leave, to put that in the parking lot or whatever we want to call it. But our job at budget time is to review the budget position control list. And things change over the year. Things change during a grant cycle. And we still control a department's the number of employees and their positions by the budget we give them. And if we say, well, we had 2 deputies that were grant funded and the grant's gone away, do we want to add 2 deputies to the sheriff's department, or do we want to add an engineer to the public works department, or a position in the auditor's office? I mean, the concept, I like the concept, but I think our obligation is at budget time. And I don't think we should be tying up the hands of a department to add all the caveats to a position. Because every time we have a grant position, that same question comes up. And every year at budget time, we have the opportunity to do something. If we don't fund the department, they don't fund the position, or they keep the position and they unfund something else. That's their charge. So I don't feel a need to add another caveat to this. Mr. Stopper.
I understand where you're coming from, Madam Chair. Respectfully, I do agree that we should apply to them all equally. I do agree on that, and if we're going to do it with this one, moving forward, I think this is a first step towards solving this. And second of all, this is a 5-year grant program we're just talking about. Very well, during budget time 5 years from now, there may not be one of us here. and they may not be aware of that. So without that being on there, that's a reminder to everyone in the county. It's their duty to bring that back to the board and make them cognizant of the fact that, look, this money, this time's up, this money's up, you know, we have options for this employee, we value this employee, here's the option, and then the board can approve. But, so I take it, I do agree with you, apply it equally. I think it's something as a step forward in the future that, that solves the situation.
Well, every time it comes up, we pound our chest and say, when the grant is up, the position's gone. And we've been doing it for years. And nothing changes except at budget time. When we tell a department, this is how much money you have, how you want to manage it. If you want to have X number of employees, not X plus 1 or 2 grant positions, then it's up to them to find the way. It's not the person, it's the position. And, in 5 years or 2 years or in 3 months when another department comes to us with a grant position, so what? It's a grant. A lot of our positions are grant funded. And we have the opportunity at budget time to deal with that. We deal with all the positions. So I don't know why we need to put in extra work for a department on something that it's our obligation at budget time. My position, anyway. Is there any further discussion on this? Is there any public comment on this item? Okay, I'll entertain a motion on item 15.
Madam Chair, I would move this item with the caveat that it comes back at the end of the grant funding for the board to reconsider.
Is there a second?
I'll second that, Madam Chair.
Motion by Supervisor Toffenelli, second by Supervisor Stopper. All in favor?
Aye.
Opposed? No. Passes on a 4-1 vote. Supervisor Callaway in opposition. All right. Do you all need a break before we go to regular agenda 2? Okay. No? All right. Yeah. Ben, did you want one?
No, I got a break when I got elected, so.
Ah.
Is that what you call it?
Okay.
Sentence.
All right. Let's move to item 22, OES, receive tree mortality implementation update from TSS Consulting. Mr. Osborne.
Good morning, Madam Chair, board members. Chad, are you on, sir?
I am unmuted, I think. Yes?
Good morning, Tad.
Good morning.
Madam Chair and Supervisors, myself and our tree mortality program manager, Tad Mason, are here this morning to provide you with an update. And if I may share my screen, I will do so and we can get started. There it is right there. Thank you, Madam Clerk. And okay, can everybody see the project summary page?
Yes.
Okay, great. And I'll turn it over to our project manager, Tad Mason. Tad?
Yes, good morning. So this is the quarterly recap regarding the tree mortality program. And we have a short 6-slide deck to go over this morning, so I'll move right through it. Just a quick recap though, slide 1 there. Program's been underway since 2018. We have successfully completed 31 projects, totaling about 9,400 trees being mitigated. And when I say mitigated, that means basically felled and removed for the most part. Occasionally, trees are left on site if it's a sensitive area, such as a creek bed, or there's archaeological, cultural concerns. But for the most part, all these trees have been removed, and many of them have been hauled off to local sawmills and the particle board plant there at Martell, the Ampine facility. Some of the material is going into biomass power plants at Sonora and Rockland. Currently, we have Project 31 underway. I'll talk a little bit more about this on slide 3 or 4. As far as our outreach goes, we have gotten creative lately in our outreach to the public. Of course, our objective here is to secure right of entry forms from homeowners that have property adjacent to county roads where these hazard trees may impact the traveling public or the right-of-way. And sometimes getting these right of entry forms back is challenging. Lately, we've been working with Director Osborne on putting together an article for the county Facebook page, and that's gone quite well. We've had some good response. We've also worked with local radio station KQBM, Blue Mountain Radio, on a 90-second public service announcement, PSA, and that's gone well. So our right of entry form responses have been doing okay. Of course, we maintain the tree mortality website. We issue monthly press releases, and we field calls and emails from the public. So that is going well. We do maintain a contact log of every call that comes in and most emails. So we have that. Also, we do work closely, next bullet item here, with Director Osborne on putting together the preparation of reimbursement requests to Cal OES. Of course, Cal OES covers about 85% of the costs involved here in the tree mortality program. The other 25% is lately been covered by CAL FIRE, and that's working with their local assistance tree mortality program, which is LATM, and that budget is about $68,000. It was just reinstated here recently. So funding levels are going well. The last slide of this deck will show the details on the financials regarding that. Right now, we're surveying the entire county and laying out our next series of projects, basically 32, 33, 34, and 35. Next slide. Sorry about that. Mortality in the pines has started to taper off. Unfortunately, due to the prolonged drought conditions, we have seen insect attacks come in on some of the oaks, gray pines, incense cedar, Doug fir, and upper elevation true firs. This is consistent across the Sierra Nevada counties. Other counties we're doing work in, El Dorado and Amador, are seeing similar mortality in the oaks, gray pines, cedar, Doug fir, and true firs at higher elevations. Even lodgepole pine at higher elevations is giving up the ghost in many locations. We, of course, have had some heat wave weather situations come at us, and that has brought on another hatch of bark beetles, primarily western pine beetles, colitis, and some fir engravers. And we are monitoring the insect infestations very closely. We do see some reluctance from landowners to sign off on the right of entry forms, but we continue to use our outreach tools to change those, to bring those landowners over so we can get the work done. Next slide. This is just a quick recap of projects that have been completed this year. Project 9 was on BLM lands and entailed 387 trees removed. Project 25, Highway 4 corridor between Arnold and Murphy's, 263 trees. That went well. Project 27, West Point, Wilseyville, Glencoe, Railroad Flat, big geographic area, 223 trees. Project 22, this was BLM parcels, large project, 564 trees, and that went well. Next slide. 26, Sky High Ranch, this is upper elevation to county line, 101 trees. That was completed without any issues. Project 28, U.S. Forest Service parcels, 113 trees. This will be our last project on U.S. Forest Service. It pretty much cleaned up everything that we need to get done along county roads. Project 29, Highway 4 corridor, 304 trees. This was done by a local contractor, proper pruning, based out of Murphy's. Always great to see local contractors involved. Project 30, Big Trees Village, 38 trees. We've been bringing our project size down as far as number of trees so that hopefully we can bring online more local small contractors. This particular project 30 went out to Central Sierra Pest Control, small outfit based out of North Fork. Project 31 currently underway, has 53 trees, and it went to Oneto Tree Service out of Dry Town. And Project 31, I believe, has been pretty interesting. We did have a relatively high hazard tree on Stella Drive removed. I believe Supervisor Callaway had a chance to see that actually happen firsthand. We had to bring in a crane to make that happen, but the tree removal was uneventful. Next slide. Okay, 32, this is, we're getting into our upcoming projects. Project 32 is being bid out right now. It's currently posted on public purchase, and we expect to have the bid October 22nd. Project 33, extending from Blue Lake Springs to Angels Camp. About 260 parcels involved. Our crew is currently marking that. Project 34, West Point to McCalmy Hill. Once we're done marking 33, we'll go to 34. And then because of tree count, we have created Project 35, which is Big Trees Village to Blue Lake Springs. And that will be likely one of our last projects to be marked this year. Next slide. Okay, this is the last slide in our slide deck. This basically summarizes all of the damage survey report reimbursement applications submitted to Cal OES by the Director Osborne. We had a hand in helping with that, but this is a sheet that summarizes all of those reports and reimbursements incurred. You can see column 5 there, approved 75%. So basically 75% of the cost of the tree mortality program are covered directly by Cal OES, and then they add on a 10% administrative allowance. See that next column, column 6, as reimbursement. So the total reimbursement from Cal OES is 85% of the cost. On top of that, the next column, thank you, John, for highlighting this with the cursor. Good job there. The next column is the LA ATM reimbursement. Of course, this is the CAL FIRE participation at 25% for the local assistance tree mortality program at ATM. And for a number of months, it was not funded. In fact, the first half of this year, basically, actually from the last quarter of last year to the first half of this year was not funded. However, the California legislature saw through this and decided to fund it again, and the allocation for Calaveras County was $68,000. So for upcoming projects will be covered on that 25% participation at $68,000 total. So cost per tree is averaging $473.11. That's up slightly this year, mainly because the trees per project are fewer, so a little more administrative costs. And also the trees are widespread. We've, with our first two rounds of projects, we're able to take care of the lion's share of the concentrations, and now the trees are spread out a little bit more. But with that, I will stop and field questions, unless, of course, Director Osborne, do you have anything additional to add?
Yes, sir. Thank you, Tad. Madam Chair, board members, if you look at the notes of this spreadsheet, you will see that there's $68,508 of reappropriated LATM money. You'll see that board item for the acceptance of that grant at your next meeting. And in a nutshell, what that is the 10 counties that were given CDAA funding, or I'm sorry, LATM funding, local assistance tree mortality money from CAL FIRE. Not all of them spent all of their money. We were one of 5 counties that did. And so what they did is they gathered up the outstanding money from the leftover funds and redistributed that. So we're getting a second bite at that apple. You'll also notice that the total net reimbursement minus cost is negative $98,826. If you offset the $88,000 in BLM funds that we've received, at this point in our project, it is costing the county of Calaveras about $1.15 a tree out of pocket to remove these fuel hazards from the county. So we've been very successful in keeping the cost per tree out of pocket to the county at a minimum, and we have a lot of remaining funds from the PG&E allocation that you guys were thoughtful enough to provide us last fiscal year, and that the impact to that PG&E budget will be even less now that we have the LATM funds. So with that, I'm happy to answer any questions you may have.
Okay. Supervisor Mills.
Thank you, Madam Chair. John, this is a question I should have probably sent an email to you to ask you about in advance, but a question regarding all of these projects, how many of them have been closed and are fully reimbursed at this point? If you don't
I would
have
have
the
to
answer,
look.
I understand.
I'd have to look, Supervisor Mills, but I think we have one more project that we are waiting on LATM funds for, and that's it. Everything else has been reimbursed or has been submitted to CAL FIRE, or I'm sorry, Cal OES.
That is fantastic to hear. It's always kind of been a struggle to get these projects closed and reimbursed, so kudos to you and the team for getting it done. Last year, this past year, we've kind of been in a drought. And most time because of the COVID, most people weren't aware of it. We're going into a potential drought year again this year too, so we're talking about wet year versus dry year water. Likewise, trees, are we going to start seeing a spike in tree mortality, Tad? Or, are we starting to see it now?
Excellent question, Supervisor Mills. Our our contract with the county has just been extended, or will be extended as we sign this amendment for another year through October 22nd of next year. And I think the primary motivation for that is to address your question. Will there be additional mortality? And, you know, it's hard to forecast as far as what the tree count will be. There will be additional mortality, I can tell you that. The question is how much and at what elevations. A lot of it has to do with how the hatch, the bark beetle hatch takes place, the timing in the springtime through the fall, how many hatches take place, and then how specific species do. I mentioned that the true firs and the lodgepole pines at upper elevations are really being impacted. That was a little surprising to us, frankly, but that's an example of some regional impacts at certain elevation zones. We think that may happen again next year, and it may be the front country next year, or it may be, you know, between 2,000 and 4,000 and really hit the pine. So we'll have to see, but we are monitoring it very closely.
Appreciate it. Thank you.
Supervisor Garamendi.
Thank you very much, Madam Chair. And Tad and John, thank you very much for this report. Clearly, we have got this system pretty well figured out, and the system seems to be working correctly, both for the county and our local contractors and our property owners. When you look into your crystal ball, I know we got this reallocation of LATM monies. You know, we look at state budget, CAL FIRE budget with all these major fires going on. We know that, as Supervisor Mills pointed out, and you mentioned, Tad, we don't know what's going to happen with the tree mortality going forward. We could basically, I'm going to assume that the trees are going to continue to die. So what's the future look like for our funding as you guys look at this next year?
Thank you, Supervisor Garamendi, for the question. I'll start and then I'll turn it over to Tad. As we have moved through this and streamlined not only our process but increased our knowledge of what's available, we're going to do a couple of things to seek to continue the funding stream. Number one, we're going to pursue an agreement with BLM. We're looking at 2 different agreements to see what will fit best for us as a county. And once we pursue that, we may be able to continue the funding stream through that. Number 2, CAL FIRE, they offer grants annually, and you've seen many local entities apply for those fuel mitigation grants. And really, while this is related to bark beetles, it is fuel mitigation. We've successfully removed 9,400 dead trees from the county. That's 9,400 fuel sources that will not cause us or will not cause us a wildfire or will not exacerbate a current wildfire. So we have that avenue with fuel mitigation grants. And lastly, the CDA funding, which is the California Disaster Assistance Act, money has been reliable since the inception of this program. And so as long as that holds out, we will continue to seek out ways to offset the remaining costs of the county and keep that per tree count at $1.15. So it may go up, but we're getting a heck of a deal for the work that we're getting done out of the county coffers. Tad, did you have anything to add to that, sir?
No, John, that was well done. Just to give you a quick overview, we have an excellent working relationship with Calaveras. Pete Grace is our primary contact, and we do ask him from time to time what is his crystal ball as to how long this funding will continue. And he's been optimistic. It, of course, falls back to the legislature and how they allocate funding for the upcoming fiscal years. But considering the experience of fire season 2020 I'm optimistic that the CDAA funding will continue. So, back to you, John.
Thank you very much.
Thank you. So, you're welcome.
Okay, guess that was pretty clear. Any other questions? I have a couple. On slash, is slash being removed too? That's usually where I get the most complaints.
Yes.
Yes, Madam Chair. When our crews, our local contractors are working for us, we have a very specific job scope that includes reasonable slash removal, as well as removal of the actual tree. There's a couple options for our property owners. If they would prefer that we leave those logs or leave the tree, we are able to do so. And in a very small number of situations where it is unsafe or unreasonable for us to get the medium equipment in to get the tree out safely, we are forced to leave slash and some trees. But we try not to. Obviously, one of the larger goals of this program is to remove fuel from the forest bed, and if we're leaving slash, that we're not accomplishing that goal. More often than not, the complaints regarding slash that we see are from other programs, and we have become very akin at communicating with those other programs that there is an issue with slash, and they are generally responsive to those requests to clean it up.
Generally being the operative word. On a right of entry, what are the reasons that people are not completing them? And is there something, at least in the Ebbets Pass corridor, I could do, or Supervisor Garamendi could do in his district?
Thank you, Madam Chair, for asking the question. More often than not, a couple of things happen. Number one is people actually think it's a scam. It's not often that somebody comes knocking on your door and authentically wants to do something for free that helps you out. And so a lot of people just flat think it's a scam of some kind or another. So that's what I see most commonly in my office. The other issues that we see is, or are, that the property has changed hands or the addresses are not up to date for the responsible party, and the right of entry form kind of gets lost in the shuffle. And then the last and probably the smallest group is some people do not want local government on their property without them there. And of course, in those instances, we have our professional field foresters make an appointment and meet with the property owner so that the property owner is present and sees what we're looking at and can be an integrated part of the process. Tad, did you have anything to add to that?
No, I think that's well put. I will tell you that there is a certain part of the population that refuses to sign any form. I think we've all seen that. And then there are certain communities in Calaveras County that the landowners are concerned that we're part of some inspection team that's looking for compliance issues on properties, and you have to field those questions quite a bit. That no, we're not really here to do compliance work. We're just here to remove some hazard trees. So anyway, that's just a quick observation.
I guess we're a home rule county. Thank you. Are there any other comments, questions from the board? Are there any public comments on this item? Okay. Thank you both very much for this. We'll see you in another few months.
Thank you, Madam Chair, and thank you for continuing our contract with TSS.
Yeah, we had to
Yeah.
discuss whether we wanted to hear their report before we approved it, or should we approve it, and then he would have to make sure they did a good job on the report. Okay, thank you.
Thank you, Madam Chair and board members.
All right, let's move to item 23. This is a public hearing on a resolution approving an addendum to the general plan environmental impact report and adopting a general plan amendment to revision table LU2 of the land use element. I'd like to open the public hearing and ask for a staff report on this.
Good morning, Madam Chair, members of the board. Peter Maurer, Planning Director. So this is first of two sort of cleanup items that we have before you today on the general plan, both dealing with the land use designations and land use map. Table LU2 identifies which zones are compatible with the various land use designations that we have. We have started the process of bringing the zoning into conformance with the general plan, and it's taken quite a bit of research. As we were doing that, we noticed several anomalies with the zoning, and particularly this table. So what we're proposing here, and if you go to page, it's agenda packet page 362 in my version of it, hopefully it's the same numbering in yours, you see where the proposed changes are. We're adding some zones to a variety of the land use designations that we believe more appropriately addresses some of the issues of some of the unique uses that we have. I'm hoping that the staff report that you received adequately explains all of the reasons why we're proposing these changes. But if you have any questions about any specific ones, I'm happy to go into further detail on that. We did prepare an addendum to the EIR for this, found that there were no new significant issues that needed to be addressed in the supplemental or subsequent EIR. So at that, I'll just make this short and sweet. If you have any questions, I'm happy to answer those for you. We did receive one letter at the Planning Commission hearing. I think it was copied to you as well from the Calaveras Planning Coalition. They support this change. We have not received any other comments from the public on it.
Are there any board questions on item 23? Mike, please.
Mike's on.
Thank you, Susan. Are there any board questions on Mr. Mills?
Yes, Peter, one kind of sticks out at me, and it's our packet page 363. In the agricultural preserve, you have noted rural residential.
Yes.
I don't understand the overlay there. Could you explain that a little better?
Yes. So in the prior general plan, there was a policy that indicated that the ag preserve zoning is compatible in all land use designations. We didn't think that was quite appropriate, but there are a number of situations where a rancher has a large piece of property, maybe is acquiring some additional land nearby, and it could be a combination of smaller parcels, some 5 and 10 acre parcels adjacent to a 100 or 200 acre parcel. And for the most part, this could be sort of a temporary situation. The land is identified as appropriate for future 5 and 10 acre parcels, but there's no market for it right now. It's being used for grazing cattle. We have a number of policies in the plan that talk, that promote the use of the Williamson Act to protect the agricultural industry. And we've just found that there are a number of even recent applications for Williamson Act contract that combines parcels with a variety of different land use designations, including rural residential. So we felt that this was appropriate.
Okay, thank you for your response.
So dovetailing on something similar, why would we put AP in the RR?
Well, that was the same question I thought that Supervisor Mills had just
Oh, I
asked.
thought you said timber preserve.
No, no,
Oh.
ag preserve.
Okay,
But-
yeah,
but,
that is the same.
it
My
is the same
gosh, you mean
question, yeah.
Dennis and I had the same question?
You better duck and put that one on the tape.
Yeah. Do you have anything else, Mr. Mills? Okay, are there any other comments after Peter's? Yeah,
Yeah, Peter, I do have one under PS or public service.
Yes.
You're moving it to commercial?
We have a number of public facilities that are located in commercial areas already. Primarily, this recognizes that public utilities and other public agencies have a lot of different facilities scattered throughout the county. In some cases, they may be an office space. In other cases, they could be power substations or pump stations for sewer or water districts. And we've zoned all of those public service, but they're often within a variety of different land use designations, including commercial, industrial, and the mixed-use community center designations. For the most part, the public service zone allows a variety of non-invasive or non-intensive uses by right within those zones, but anything that is more intensive use, a sewage treatment plant or something like that, is going to require a conditional use permit from the county in order to move forward. And so we felt that it was appropriate to basically recognize and identify that those uses are appropriate. So really throughout the county, wherever the need is really, often they're based on just sort of the physical attributes of a site and wherever it can be located. So yes, we believe that commercial is appropriate.
So if there's a public utilities or what have you owns property that they're not utilizing, but it's zone PS, and it's outside all the areas that you just prescribed, and they end up selling it to a public entity, then they can open up commercial entities wherever they may be.
No, it works sort of in reverse. If the public utility has property that's on land already designated commercial, and they decide to sell that property, they don't need it for whatever reason, yes, someone could buy it and develop it commercially. But if it's on land that's designated residential or rural residential or something like that, that land use designation stays. And so if the public service, the public entity sells that property, someone buys it, they would rezone it to a zone that's consistent with that designation. So if it's residential, it'd have to go to a residential zone in order to develop it for something other than a public utility or public service use.
Okay, I just wanted to make that clear because I did have a question about that. So, okay, thank you.
You're welcome.
To follow up on that very quickly, you have parks and recreation not as one of the compatible zones or proposed compatible zones, and there are multiple public service agencies that have parks and recs.
But we have a separate parks and rec zone, a recreation zone that, for the most part, is where those park facilities are zoned parks and rec rather than public service. So that hasn't been an issue. We haven't come across any parcels that would create a conflict with that.
No argument here, Peter. I understand where you're going with that, but let's use White Pines, for example, up there, and it's owned by a public utility district that has a park on it, and that lake services a utility.
Yes.
And so, I mean, could it be both?
I suppose it could be. We haven't seen that as an issue with the, when we were going through the zoning maps to see if there's a conflict there. So, for example, White Pines is zoned recreation as opposed to public service.
Yeah, I'm not disagreeing with you on how it's been applied in the past, but I think that may come up as an issue in the future. I just noticed this, or I would have brought it up to you earlier, Peter. I apologize about that. But I think it's one where you could actually fill in a dot, and I would suggest that we filled in a dot there as a potential for the future if it ever came up, and then the decision would be made going through the planning department to see if it fit in the proper slot. Would that create a problem, Peter?
I'm not thinking of anything off the top of my head where that would create a problem. I think the only reason that we left it out was that we don't have a lot of parks and recreation land in the county. We have policies that indicate the desire to improve that situation, and would not like to see parkland developed with other infrastructure other than, provisions for park and recreation services. But I suppose you could see, I could understand where there might be, a park with a small component of that recreation facility, say it's being operated by CCWD or some other water district, where they have a pump station or something like that on it as well. So I don't know that it would cause any difficulty by adding that as a compatible land use for that.
I would, as long as you're comfortable with it, Peter, I would make a suggestion on that small amendment. And then as things move forward and someone decided they want to make that property public service, then it would still go through the review of the planning department, at which time you could see if it fell within that proper slot and was compatible.
Right, it would require a zoning amendment through the planning commission and the board to approve that and make a determination if it's appropriate.
I think there's a filter there that in the review process that would take care of any potential issues in the future.
Yes.
That's all.
Supervisor, did you have something you wanted to add?
No, I was going to agree with Supervisor Stopper, and there's been a long time talk about a portion of land in Valley Springs being converted from public service land or continue to be public service land, but be operated as a park and rec. So I think that's part of where he was going in that direction, and I would be supportive of that.
Yeah, I mean, just for example, if you were to put in multiple sports fields into a certain area and then you did proper application of reclaimed water for the spray field onto those fields, that would be a public service land at the same time as a parks and rec, just for example.
The only concern I have about adding anything, I think it's sort of a judgment call here, is normally if the and this is typical for a zoning amendment, I'm not sure if the same rule applies for a general plan amendment, but if there are substantial changes to what is being proposed that wasn't reviewed by the planning commission, it would be appropriate to refer it back to the commission. I don't know if this would be considered substantial, and I'd have to go back and look at the government code to see if the same rule applies for a general plan amendment as it does a zoning amendment.
I agree with you, it's not substantial.
I agree totally with that.
Okay. Are there any public comments on this resolution and the addendum to the EIR? Okay, I want to bring it back to the board. Does the board have any further questions or comments? Okay, I want to close the public hearing and bring it back to the board for action. Do I have a motion?
Madam Chair, I would like to move it as proposed with the one small change that is, as Peter said, not, with the one small change that's been proposed.
Well, I thought I understood Mr. Mauer to say he then has to bring it back. This has to go, you want it back, or do you want it as submitted?
He did not say specifically that he needs to bring it back. He said that possibly it's not substantial. It's
That's
not.
correct. It would have to go back to the planning commission if it were a substantial change.
So
I would maybe add a line, we can add a finding that the addition of the public service zone as a compatible zone within the Parks and Recreation land use designation is not a substantial change to this amendment.
Okay.
I would concur with what Peter just said, and I would rephrase my motion to include what he just said.
All right. I have a motion by Supervisor Stopper on the resolution approving the addendum to the EIR with the addition of public service to the Parks and Rec, and the adopting of the general plan amendment revising table LU2 for the land use element. Is there a second?
Second.
Second by Supervisor Tuffanelli. All in favor?
Aye.
Opposed? Passes on a 5-0 vote. Thank you, Mr. Mauer.
Thank you, Peter.
Don't go anywhere. We're going to item 24. This is also a public hearing, adopting a resolution to approve the third addendum to the general plan EIR and adopting a general plan amendment on the land use map LU1 for the land use element of the general plan. I want to open the public hearing and turn it to Mr. Mauer for a staff report.
Okay, again, this is another cleanup item, and what we found in going through all of the zoning, we asked the GIS team to look at all of the parcels that were incompatible with the land use designation based on the previous table LU2. As we did that, we found, again, there were a number of anomalies and inconsistencies. I think that primarily when we were doing the countywide land use mapping, we weren't looking at each parcel individually. We so looked at it as a whole. And although the land use designations apply specifically to parcels, we didn't double check each and every one of them. What we found was, in some cases, just errors were made. For example, in Copper Cove, there was a large section of that subdivision that's zoned R1, developed in R1 lot sizes. Many of the lots are built on, but it was just sort of picked up as a generally as a rural residential, since much of it is also 1 acre and larger parcels. So these are sort of map corrections that we're making. And so, again, there's a fairly long list of parcels that were just primarily in error. Some of the other things that we found, for example, was that the R3 zoning differs in the R2 zoning only by the type of units that could be built. R2 is limited to either a single family or a duplex unit. And the density is limited by the general plan land use designation density. So, for example, we found that there were a number of townhouse projects, other things like that, that were developed as R3 zoning, but included in the medium-density residential designation because of the density. So rather than go back and create all of these non-conforming parcels, it seems to make more sense to clean it up, to recognize what's there. Now, all of these are based on existing land uses, so we're not increasing the density or intensity of uses, although we are, on the map, it looks like that's the case, but it's really recognizing what's on the ground today. I have the ability to share the GIS screen. If you have questions about any specific parcels, we can go to those. Again, I hope that with the description in the staff report, the attachment that shows, what the land use is there now, what's existing land use designation, I think was attachment 1 to the report, that provided enough explanation of why the changes, and you can clearly see that these are changes to represent what's on the ground today. There was a question that Supervisor Mills asked me earlier about notice. We did not send out mailed notice to each individual property because there were over 1,000 parcels that would normally be notified. We're not required by law to do that. We did do it in the paper. That's sufficient under state law. I think that if we were actually downzoning parcels, it would have made sense to do that, but really what we're doing is cleaning up to recognize what the existing zoning is there, what the existing land use is, and the owners won't know that anything's changed because in reality nothing is changing. It's just maintaining what's there today. So unless you have any questions about any specific issues or general questions, that concludes my presentation.
Does the board have any questions on this item? No. It was a good staff report. Thank you. Are there any public comments on item 24? Okay, I'm going to bring it back to the board. If there are no further items of discussion, Mr. Mills, are you ready to push a button to ask a question, or do I? No.
Madam Chair, I'll make a motion, but we got to close the hearing.
I got to close the public hearing,
Yeah.
and then you can do that.
I was hanging on.
Okay, I'd like to close the public hearing and bring it back to the board for action on a resolution approving the third addendum to the EIR for the, general plan, adopting a general plan amendment, amending the land use map of the land use element. Mr. Mills.
Madam Chair, since most of these parcels, or a good majority of them are in Copperopolis, I'll make the motion to make the adjustment.
Thank you, Supervisor Mills. Is there a second?
I'll second.
Second by Supervisor Tofanelli. All in favor?
Aye.
Opposed? Passes on a 5-0 vote of the board. Thank you, Mr. Maurer.
You're welcome. Thank you very much.
Okay, I'd like to move to item 25, select a member of the board to act as the CSAC representative and an alternate for 2021. Since I am the representative, I would like to stay on as the representative. I'm not sure.
I would enjoy continuing supporting you as the alternate also.
And you'll be the alternate? Yes.
If the board so decides.
Yeah, we did. Oh, gosh.
The quid pro quo comes out.
Oh, yeah.
What do we get in exchange?
Well, he did bring you a burrito.
What are we going to get in exchange?
What'd you give us?
I give you
A
that we
headache?
will finish this meeting before noon. You wanted to finish before noon, right, Supervisor?
Would you like a motion?
I would like a motion, please.
Madam Chair, I would be happy to nominate you as our representative and Supervisor Stopper as our alternate.
Thank you.
I'll second.
A motion by Supervisor Stopper and Supervisor Garamendi, and an enthusiastic second by Supervisor, thank you. Is there any public comment on this item? There is no public comment. Thank you, public. All in favor?
Aye.
Opposed? Passes on a 5-0 vote. Thank you. And we'll move to supervisor announcement. Does any board member have an item that they would like to discuss or tell us about? Mr. Mills?
Yes, Murphy's Fire has announced that they are back to full staffing and that most of the apparatus has been returned. There's only one strike team out in Calaveras Tuolumne Ranger Unit right now. So they're working with the Bureau of Reclamation to reopen natural bridges. And also you may notice that stop signs, stop lights in Calaveras County now are going to start seeing reflective surrounds on them.
What does that mean?
In other words, there's a yellow reflector that will be surrounding the stoplight. They put them up in Tuolumne County over the last couple of weeks, and coming into Angels Camp this morning, they're on the stoplights there at 49 and 4. And it's because of the PSPS events, to be sure that people understand that when those lights aren't working, there's something there to indicate.
Good.
So Caltrans is working on that, and it's very noticeable, so appreciate that. Library and Angels Camp, any donations would be appreciated. As you know, we're in the process of transitioning to a new location, the old Umpqua Bank, and it, according to Nancy, should be open possibly at the end of October. So any way that people could support getting that library up and operational. Remember, that's a resiliency center as well, and will give us additional location, space, et cetera, that has been long overdue in Angels Camp. So very much appreciative to the Friends of the Library in the Angels Camp area, as well as Nancy and her team for making that happen.
Thank you, Mr. Mills. Mr. Tafanelli.
Well, I want to send out kudos to Barbara Sullivan and her staff. Big thank you. Got my property tax bill in the mail last week, so thank you for doing your job.
If Ms. Sullivan's listening, she knows what she needs to do before the due date that the property tax bills are due. Mr. Stopper.
Thank you, Madam Chair. Since the last time we met, we did have another Fish and Wildlife meeting. It went really well. It was an excellent presentation by Mr. Dillinger, who's doing the research on mountain lions across the state. A lot of good information, and it was quite interesting. If you didn't attend, you missed out. It was really good. But you can probably catch up a little bit because the Enterprise did do an article on it because they attended. Also, I would like to bring up that with us being in the orange tier and us going through COVID for the last 6 months, we've stood back on doing study sessions for quite some time. We're going into a new year. I'm not saying COVID's over by any means, but a lot of times we talk about structure and everything, how we're going to move forward, and our plan as we move forward. And we've discussed many times doing a strategic plan. And I would like to propose that we do a study session or two before the end of the year, one or two, on possibly getting a presentation through CSAC or another, entity or people that have successfully applied a strategic plan to the board, so that we could, so that we go into the new year in January, possibly with a little more knowledge and a better base and understanding on how we decide what we want to do as we move forward.
I mean, how to structure the actual doing of the strategic plan.
Absolutely, ma'am.
Okay, where's the board? Is that acceptable to you? Okay, I think that's a good idea. Maybe we can ask Mr. Alt to put something together.
Absolutely.
Yeah, that's something that we've talked about since I've been on the board. So at least let's start moving forward.
I think we've all talked about it at one time.
Oh, yeah. think,
But-
and
but-
we have done things, the board's done things the last few years, I mean, and prior, when Gary and I were on, prior, so I think it's time
Think-
to review what we've done, so,
And then
Okay.
possibly take a step towards accomplishing it.
got
We'll
it.
see.
Okay, thank you. Mr. Garamendi, did you have anything? On Thursday evening at 6 o'clock at the fairgrounds, the Angels Camp candidates for city council will be having a candidates forum. I will probably be going since we will be working with the City of Angels. We're going to be doing another cleanup on Camp 9 Road. On Sunday, we still have some more cleanup to do, and I really want to thank Kopavi for pushing this forward. And that's it for me. Ms. Lamble, do you have anything? Susan, do you have anything? CAO Alt or Council, do you have anything since I see you? No?
No, Madam Chair.
Okay, CAO Alt? Do you have anything? Nothing? Okay, please let the record show that we are adjourning this meeting at 11:17, and Mr. Garamendi can go home for lunch.
Madam Chair, we are reconvening back to
that's right. I tried. Oh, my gosh. Thank you. Thank you. Well, maybe we can listen fast. We will adjourn into closed session. Thank you.